level or the
so
box
that
that says
there's no
mid-level,
chance that it
and then
doesn't
set
fit
my
right away,
numbers.
or they're bumping, or they're
Alright,
cold and
so
flexion
then you
and
work
things
your
like
way
that
back
in the
around,
hallway.
treatment time minutes,
And these
that
don't
button's
come
flashing,
with-
so let's
I'll show
just
you the
say
newer version of
3
this
minutes for this
And
one.
then it has the strap.
And then that leads you back around to start.
Now, for the purpose of skill
Okay.
check, you're gonna
Alright,
use
so
the
I
strap.
check in again, how you doing?
Clinically, if I have somebody
Feel
who's
okay in this
claustrophobic,
position? Alright, we're
I don't
good.
use the head strap.
So I'm going to hit the start
So
button.
if somebody says, you know, I really don't like these straps, no problem.
Success, it didn't beep.
Because the head
So if
strap
you have
just
anything
provides
set
very
incorrectly,
mild
it's going to beep at you.
stabilization force, but it really
So we're
isn't
gonna
the
check
point
how
of
is
pull.
that force?
The point
You
of
shouldn't
pull
really
is
feel
from
much because
here and here,
it's only
this
going
way.
to 10
So that's
pounds.
just a little
Okay,
stabilizing
you doing all right
technique
there?
force. So I'll just take it out.
Okay, so with
It
less than 20 pounds, you're not even
But
getting enough
the first
pull
skill
to
check.
actually elongate the spine at all. It's just
So
a
this
little
is
bit of soft
it's
tissue
set up
stretch.
just like that.
Okay,
So
so
open it
here we
all
go.
up.
It's going to
Make sure
count
it's on a
down
sturdy
how much
surface so you can,
on time you're
keep it in
on. So she's
know,
at 30
this wouldn't be a
seconds.
problem.
So we're gonna
So you
wait.
just have them go the other way.
If the
on
patient
flip side.
wiggles at all, so go ahead and wiggle around a little bit.
It's a very simple pneumatic pump, just like bicycle pump.
You'll
It's a
hear
very
that.
simple valve. It's
You'll hear that
labeled.
engage again,
Pull,
because if you wiggle,
pump,
that
release.
takes the pull off of the
Okay, so
machine,
you pump,
and it
it
goes,
puts
oh,
air
we're
into
not
the-
getting the right amount of pull, and it starts to
slides
pull
upwards
again on
just
you.
like that.
Okay.
I'll often show the patient so they can see how
So the
it's gonna
first time I
work.
used this in the clinic,
And
and I
then
had
to
never
release,
used one
it's a
before,
nice-
other than
no,
being
the weight of the
taught
head
in
will be
school
in it.
and
It
then
just
going
slowly lets back
to
down.
clinicals, and they were
That's way
in a corner somewhere else,
That's
that's where you
correct.
went and
Yeah.
hid,
I do.
and
I
you
do.
did this sometimes to think you had a
Okay,
headache.
so I do that for
So
you
I
guys.
go in
This
there
is
and
what I
then
do
the
with patients,
PT's
right?
very fast, and he
There's
wants
really a
this
fair
and
amount
this
of
and this
pressure.
and
There
this,
you
and
go.
I go in, and for 3 or 4
Go ahead,
times in a
Michael.
row, it just kept beeping at me, beeping at me,
Fair
beeping
amount
at
of
me,
pressure goes
and
in
just
there
demoralized me
relatively
the first time I ever tried to
Because
use
that's
it.
the slide.
So, just be calm, be
So when you're
patient,
actually
think, okay,
applying
what am I
yourself,
missing?
it doesn't
Go
take
all the
a
way
whole
through your
lot
steps again.
to start to pull.
Okay, so after that first pull, as I was talking,
Now,
here I'm going to
yeah,
actually
it's
release
not
the table.
beating it because there isn't any counter pull.
Okay,
The
so then
pressure
now you'll
here,
hear,
when
oh,
the
it's got
when
more room to
you
pull.
apply the
So then
pressure,
Stacy should
it
feel
leaves
just a
the-
little
the
bit of opening.
resistance,
Again,
the
we're not at a
friction
high
force,
enough
and
amount
that's
to
what we
actually
do here.
get much pull
So
here,
that's how you know how
but
much
now the
pressure you're
table's
applying
gonna come
across
with
that
her,
friction.
so we don't have to work
This is a
against
home unit,
that
yes.
friction.
Should we try to time the release when we're, if we're
Yes.
doing
That's part of your
intermittent?
Yes,
instructions.
absolutely,
That's part of your
absolutely.
instructions, so you always do
Mhm.
this in the
So
clinic
after
to
that
get
first
to them
pull,
home.
it goes to that release time, unlock your table.
Is there,
This,
is there like a
goes up to
pause
50.
button on the machine at all, or is there just
There's an
a?
emergency
Just
switch.
an emergency
There's an
stop?
emergency
It's
switch
emergency, you have
hanging
to start over
They're
again.
going against your instructions,
right
which is
across the
equivalent
back
of
of the
taking
bar,
more
way back.
medicine prescribed.
I don't see a pause on
So
here.
as long as you give them
And that's
the
another question
instructions
I'm
that
going
they
to have to
should
find out
follow.
about increasing or decreasing while this is actually going. I'm pretty sure there's a way to do it, but I cannot remember exactly how it is to actually be able to increase
And that's
your,
part of your instructions,
pull,
that, you know,
yes.
this is
What
a
about the
therapeutic
emergency
level.
button?
that's
There really is
next.
no
Alright, so
evidence
once
to
I'm
suggest
with
that
her
going higher is
and
better,
I
right?
make
That's
sure that
reported in your
everything is
textbook.
okay,
So
I'm going to
you risk
give
an
her
injury by going higher,
the kill
but you don't
switch.
necessarily gain any benefit by going higher.
Okay, so we
really
want the
not
patient to
much.
feel as comfortable as
Same with
possible
Kenzie,
and to have control. So I'm going to leave that switch with her, then I'm also going to leave
Yep.
Bell. Thank you. You might have to
There's
do
a
that thing.
Okay, so,
Oh, there we
how
go.
to get
Thank
into
you.
it, part of the
Okay.
instruction is
So
that
you have a
body
bell
mechanics,
and a
right?
call button, so you can
So
pretend you're playing
somebody
Jeopardy
help me.
while you're in
What would you
here,
tell me to
but
do?
I always make sure that I set a timer and come back and check. Usually if it's the first time I'm seeing a patient, I'm gonna stay in there. I'm gonna stay in there pretty much the whole treatment, just because I wanna make sure they're okay. Cause that's very anxious to be lying there on a table, strapped into this rack, and you've got your button, and then someone goes away and you don't know when they're coming back. So I always stay with them for a while. I may step out for a minute, but then come back. What you will often find as well is if someone has been in pain for a long period of time, and this is when they first get any relief of pain, they may fall asleep. And when you fall asleep, your grip opens, and next thing you know, the button's on the floor, the hand drops and it knocks the other button off the table. They're called button. So definitely go in and check on them very, very regularly. If you do move on to something else, make sure you come back. And make sure you set the timer. You don't want to leave somebody on a table. I've had patients in the past come out. Where'd everybody go? Someone left me on the table out there. That's not good patient care. Not very, very patient centered. Okay, how are you doing?
Fine.
You all right?
Now you can do this for them.
So not very much
Oftentimes, if
pull
they're
here
gonna
to
be
be
doing
able
this at
to
home, I
feel
have them
it.
do it right
You'll
away.
oftentimes hear
I say, reach
patients
back,
say, I
and I
don't
say,
really
now
feel
try
it
the other
anymore.
hand.
But as soon as this
they both work.
releases and we
So you
slide
can
that
use
table
either
back
side,
together, they go,
no
oh wow, I
problem.
guess that really
You
was
should
making me
feel it
taller.
yeah,
And I'll
get
say,
your hair
yeah,
out of
there
it.
was a
Should
gap
feel
in
it
the
kinda
table,
gently
only 4 or
squeeze.
5 inches.
Once you feel it gently squeeze just a
So
little bit.
if you have patients of certain
scoop
body
down towards your
types,
feet.
what are some things to
And
be
you should
aware
feel
of with your
This
setup here?
contraction holds you back.
Increase
Patients
friction.
with certain
That's where
body
you wanna
types, what can you
And you can
be
continue
aware
to
of
tighten
with
it.
this table, with body
You should
types?
feel snug,
Well, when you're cinching it back together,
but you
don't
shouldn't
get
feel
them in
any
the table.
changes in your vision.
What if
Why
you
would
have
people
somebody
experience
who's a
change in their vision?
pear-shaped person? So they have hips,
hips.
thin
Especially on the
waist,
occiput. You got
wider hips.
suboccipitals there, it may
How's
affect
the
the
belt
eye function.
going to fit on them? How's the harness gonna
Now,
fit?
what might you wanna give me
Well.
for comfort?
Well, because you've got a hold of their rib
Pillows
cage
or
high,
bolster or
and then the
whatever,
belt
you
sits
know.
over top of the iliac crest, and you're in good shape. And if you have somebody with the opposite body
So you have
type,
those ready,
no
right?
hips
Some part
and
of
a
you have them
large
ready. Make sure they're nice
abdomen,
and comfortable, right?
so people
And then
whose
you can
bellies
let
tend
know
to
that they
hang
can
over their
adjust
belts, these
this.
may slide
So
right
some
off,
people
so that
can
may
feel
be
that
someone
headache,
that you opt for
that hurts. Well,
manual
open that up a
traction,
little bit.
a
Take
different
pressure off
type
your
of
occiput a
traction,
little bit.
because
Slow that one
your
down.
belts may not
Open it
stay
up a
on
little
very
bit.
well at all.
Yeah.
Okay,
You're gonna be all
make
the way
sure
open.
that when you know you are going to do traction with a patient on the machine, advise
can,
them about
but
their
that's
clothing,
a comfort
that they're
issue.
not wearing
If it's
anything
dangling,
big,
most
baggy,
certainly
bulky,
stunning.
sweaters, anything like that that's gonna get in
Does
the
anybody
way.
have
It's the
questions
most
about this
annoying
part so
sound
far?
in the world.
Okay.
So make
So
sure that
then,
you
once
advise
they're
them
in,
about
they're
that
gonna
sort of
take
thing,
their
that they're not
neck
wearing
strap,
anything slick, no
and they're gonna
spandex or
pull
anything, because these will slide
to
right
their
off.
comfort.
Okay,
To their
alright, so
comfort.
once we're in
I'm
this
telling
position
patients,
here,
it's not a
the
facelift,
machine is off, so I can
right? It's not a way for
slack
you to
up
do
that
so-
belt.
not like
Oh, you pulled too far on the
I'm
other
going
side.
to release this, okay? Now, what do I wanna make sure I do?
Lock the
Yeah.
table.
Lock the table.
Yes, so we're gonna slide her together,
So just
lock the
should
table,
feel
which is
gentle
another
pressure.
reason why
Shouldn't
you
feel
want
like you're
someone
getting headache.
to be careful with
feel
their
like
clothing,
someone's
because you don't want
stomping on your
clothing
forehead.
hanging
Just
down if
gentle
it comes
pressure.
out
If you
between the
need to,
belt
you can
and
do
getting
that.
stuck to the table there.
Could they adjust
Okay.
it so that the
So I'm going to release this.
Yep. Okay, who would like to try that?
It will make a
part
very
first?
obnoxious noise if you just let it go very quickly. Okay,
So you'll
I
see
can
on the
take your
dial, it says
button.
hold pump release,
so if the patient
Alright.
hits this button,
and
this machine is
before
going to
you
stop
apply traction,
immediately,
right, here I am in there,
and
right?
it's going to beep
And you're
until
gonna
someone
turn it
comes
up.
and resets it. Yes, Ben?
So does it release the tension as well?
It releases the tension, absolutely. It releases the tension and it just beeps until someone comes in. Okay, so now, I'm going to go ahead and take your leg rest, so if you want to lift your feet up for me, thank you. Alright, so let's unhook you. Okay, so now be aware before you get your patient to move, think
Okay.
back to one of the first weeks of school
Any questions?
when we worked on positioning and transfers.
Okay.
Very
So,
important if you've
a
got
very
someone
slow
with back
pull
problems or
is all
spinal
you need
problems that you take
to trigger
caution
pump,
in your transition
right,
moves.
do a pull.
So
I
if
do
you
one
have someone
pull.
who's been on a table, their back may have been in spasm for weeks
And what is
or
the black
months,
number on the valve?
keeping them locked down and immobile. And now we may have just released those muscles for the first time in a long time. Now when they go to
So
turn
it
and
only
stand
does
up,
itself?
we wanna take care
So right now,
with their movements. We don't want them just to hop up, I'm feeling great, and those
No.
muscles just recoil
What I
and have
do is I
a
do one
rebound
part,
effect. So
and I say,
if I
this
have
is
you go
10
that
pounds of
direction,
pull.
I'm gonna say, let's do a log roll.
Right.
Remember your
And I
log roll,
usually- I
keeping your
usually
knees
hang out
bent,
for a bit.
you're gonna roll all the way to the side. Okay.
Exactly.
We're just doing it that direction for camera's sake, I would have her come to me normally, okay? Then you're going to kick your feet off, prop up on your elbow, and up. So I make sure they sit for a minute and make sure that they feel okay.
Yeah, 'cause I actually do feel like
Yeah, absolutely. Once you've been lying there and someone pulls on you for a while, whether it's a person or a machine.
That happens
can
at
be.
20 to 25 pounds.
Okay,
Maybe the
good. And then depending on how high you've had the table, that's one way that you can adjust your pull,
Exactly. This is a
is
low
raising
load,
the table up to give
prolonged
a more
stretch.
perpendicular
And you've
pull,
got muscle
lower the
that
table
guides
down
because
to
of
get
pain.
more of a
You've got
flexion
fascia
bias.
that tightens in
You
response
can
to injury.
actually move
Right.
this machine. There's a pin on here that you can lift
I think so.
and move that to the right or left, so you
But,
can actually bias the
that would
pull
be a
by
entire
changing the
back,
position of
so
the machine.
nice method. But, do that
Okay,
in a
and then pay attention to where your table is.
The,
If you
the,
have
so
someone
this
who
is a
again
little bit of prolonged
has
stretch.
been
So I use
relaxed
stretching
now and you
therapeutically for
first
folks
sit
that
them
have
up, you
chronic
don't want
pain,
them to
and I
hop
do
down
not
off of the
go
table.
I don't go
And again,
by
the
that.
muscles start to spasm again. So we're gonna go nice and slow. I would lower the table down. Is there a foot pedal in the back action? Of course it's on the other side.
It's under my
Grab it
foot.
up for me. Or just hitting it, the down button for me, please.